Yeah, first of all what Lambert Drago said is true. Local production is really a challenging issue. We have experienced more than one really significant problem in our program. Nevertheless, we have shown up in the last 6 years that local production, efficient local production, is not only possible and feasible, but also it's changing the mind of many actors and decision makers in developing countries with regard to their possibilities to take their share in the international trade arena. So what we're doing is, apart from producing high quality drugs locally, is we have created a program which gives a lot of hope to developing countries that they can really turn the tables to their favor. So I'm coming now to our program. I will be really brief to give you the opportunity to give us the opportunity to discuss a little bit more than. The German program, Germany's government program for fostering local pharmaceutical production in developing countries has started in de facto 2006. We have had a kick-off meeting in Addis Ababa 2005, and as far as I see, at least 2 of the participants of today were there in the first hour. And since then, we have invested more than 100 million euros. Knowing a little bit more about the structure of the BMZ and how we work, it is really amazing if somebody coming from a sectoral unit is investing in 6 years 100 million euros. Normally we have absolutely no money to invest. So apart from the problems of local pharmaceutical production, we have had to acquire the necessary funds, which normally stands with the regions. So we have invested more than 100 million euros, activating more than 250 million euros of private investments, mostly in sub-Saharan Africa. We're talking about, let's say, 75% in sub-Saharan Africa, but also in South Asia, in Southeast Asia, in Middle East, and in Latin America. The latter 5 regions are growing, so that I think when we meet again in 5 years, it will be, let's say, 50-50 between Africa and the rest of the world. What we're doing from a political or development policy perspective is, firstly, we are supporting to achieve the Millennium Development Goals. We have heard twice today how crucial the concept of the MDGs are, and also for us it is a very important starting point. And what we do is we support developing countries to achieve the MDGs in improving access to medicines by developing their own local pharmaceutical industries and fostering private sector development and trade capacities. So we are not coming from the health side or from the health perspective, we're coming from the trade and industry perspective. So who is implementing our program? And that is also very, very innovative concept, because what we're doing is we are closely linking up the bilateral German development cooperation activities with multilateral cooperation activities, which means, of course, mainly our 3 implementing agencies in this field are responsible for the bilateral cooperation, which are the German Gesellschaft für Deutsche Gesellschaft für internationale Zusammenarbeit, GIZ, die Deutsche Kreditanstalt für Wiederaufbau, KfW, and their for private investment oriented subsidiary, the DEG, Deutsche Investitions- und Entwicklungsgesellschaft, which is quite independent from the ministry, as we have experienced. And also our Physikalisch-Technische Bundesanstalt, the PTB, who is more and more important, especially, of course, with regard to quality infrastructure. But, and this is really important, we have found two crucial strategic partners with which we can run this program. First of all, especially with regard to industrial side of the story, it's UNIDO, it's United Nations Industrial Development Organization, represented here today by Jürgen Reinhardt. This program has very successfully not only cooperated with us, but also initiated a lot of processes we would have never been able to initiate on a bilateral way. And the United Nations Conference on Trade and Development, UNCTAD, who is not represented here, who is cooperating with us mainly in human capacity development. What we're doing is we're assisting local enterprises to produce high-quality essential medicines. Lembit and his team was from the first hour with us, which means that we said, okay, there's no way that there are two levels, two classes of medicines. Same quality for all human beings worldwide. Quality means quality of the drugs. Less quality of papers or bureaucracy. So what we are concentrated in is that the drugs coming out from our cooperation partners, from industry partners, that they have to have absolutely the same standards, the same quality level as products from industrialized countries. And it works. Not with all companies, but with a lot. Much more than we have thought before. Then technology and know-how transfer for local pharmaceutical industry. Very interesting, meanwhile, the first 5 years, all technology transfer partners, or mainly all, came from India, especially one company, who was very strong in bringing technology to Africa. We see since 1 year more or less that also European partners are coming on board and helping us in this sense. I will come back to that. And another point is that we have a lot of activities for capacity development of national regional quality infrastructure by GIZ and by the PTB, and human resources in the pharmaceutical sector. Also there I will show up an example. And finally, strengthening of public institutions and local and regional pharmaceutical business organizations. Also, I will come back to that. For us, which means for UNIDO and for BMZ, a crucial paradigm is a holistic approach, which means, Lembit showed it up, we cannot go by improving one instrument or one sector, leaving other aspects behind. What we have to do is we have to tackle the situation in a specific country holistically. We have to have in our mind that there are very different policy issues we have to handle in parallel. For example, support of the regulatory authority in quality control. For example, support and development of institutional capacity and elements for setting up a national quality infrastructure, which we have made in Ethiopia, and now also we will make in the next years in the EAC countries, regionally. Reform of university and training, as well as vocational training, and of course plant level support. We are facilitating public-private dialogue on pharmaceutical sector development, which means we support national and regional pharmaceutical sector strategy building processes. For example, in Ghana and Kenya by UNIDO, for example in the EAC on the regional level, and in Ethiopia on national level by GIZ bilaterally. We bring together relevant stakeholders of public and private sector as well as civil society, and we are harmonizing national trade laws, also customs laws, to foster local production, which means we see, for us it's utmost important that you have a clear strategy, governmental strategy and governmental policy, having in mind that the way they fix up taxes or customs have a direct impact of the possibilities for a local industrial development. We help enterprises to meet international quality standards, for example GMP, but also PIC, a high European standard, and WHO pre-qualification, and to establish guidelines for the guarantee of quality standards. We help governments and governmental organizations to develop quality infrastructure systems and the harmonization of quality standards. By the way, also to make clear that we are not only looking to one side, there we have also had a lot of let's say, tries of institutions to take our experience, to use our experiences in the pharmaceutical sector and to use it for other branches and for other industrial sectors in the country. We have created now the first regional bioequivalence center in East Africa. Willy Volk and myself, we were there when it opened in November. That was done in cooperation with companies from Ethiopia and Kenya, and Germany, which is ACC for the technical cooperation, and we won 1A Pharma for financial support of the Bioequivalence Center, together with the School of Pharmacy at the University of Addis Ababa. This is an important step. What we will check out is if there's a need and the possibility and partners to create also a bioequivalence center in Western Africa. We are cooperating on training and applied research that is mainly with the St. Luke Foundation in Moshi and with Actio Medeor also in Dar es Salaam. We are training specialized production personnel and the provision of infrastructure and services for applied research. This is in Dar es Salaam. And we try to bring these two initiatives and projects together so that we have also there a unique approach in Tanzania, and we can create in Tanzania an excellence hub for these educational vocational trainings. Finally, we are also helping developing countries, that is by GIZ, via GIZ, as well as via UNCTAD and the South Center, to use intellectual property to foster local production. That means advisory services for analysis and adaptation of national patent law to foster local production, regional harmonization of patent law, capacity building for patent offices and ministries, elaboration of national IP policies, which includes policy recommendations on design of IP regime to make intellectual property a tool for development, and finally also development dimensions of intellectual property reports. We believe that intellectual property is also a crucial aspect to give local pharmaceutical industries a chance to compete. So what we're doing is we come to intellectual property rights also from a competition law perspective, which is very important. Then this is something where really, honestly, we are very proud of, that together with a huge number of African pharmaceutical companies, we were able to help them to organize themselves and their interests for advocacy. Before this project, there was only one regional association in Western Africa, WAPMA, which still exists. And together with UNIDO, we have helped to create the Southern African Generic Medicines Association, SAGMA, and together with GIZ, we have helped to create the Federation of East African Pharmaceutical Manufacturers, FEAPM. And together with FEAPM, SAGMA, and WAPMA, GIZ and UNIDO, we have helped to create the Federation of African Pharmaceutical Manufacturers Associations, which was created the 22nd of January of this year in Addis Abeba. And Paul Late is the interim chair, or first chair of FAPMA, and he's with us. So he will also lead one table in the afternoon. Finally, we have also an internet site which is only focused on Africa today. We want to win there our experiences, if there's really a need for it, which need, and how we can create also ownership for such an internet platform. And this is www.local-pharma-production.net. It's an information hub for contact and presentation platform on the pharmaceutical production in Africa, which includes information on investment, on TRIPS flexibilities, on procurement, other offers, cooperation possibilities, GMP, all on one spot, as well as protected profile and market database for manufacturers and organizations with relevant industry data. And it is run in cooperation with the regional pharmaceutical associations, and it aims to strengthen these regional pharmaceutical associations. And finally, it will be later on enhance of the regional pharmaceutical associations in collaboration with universities in Africa and universities in industrialized countries, so that we have a sustainable maintenance of this platform. Because you know, I think you're all aware, it's not easy but not too difficult to create something like that, and it is really, really difficult to maintain it in life. So that's it, what I want to share with you, and I hope we will have a fruitful discussion. Thank you very much.